Good morning, client care program members, and welcome to our spring quarterly education event. Even though it's breezy and cold and snowy outside, we're glad you're here and thank you for taking time to join us today. So we have a great presentation for you today. You received copies of the materials from Gary and me yesterday. So please have those in front of you for your reference as our presenters go through their discussions this morning. I'd like to go ahead and turn it over to Steve and Gary for a couple of opening comments that they have at this time.
Thank you so much, Jeff. Good morning, everyone. Jeff, by the way, I think your camera may be blocked by something. So it looks like we're not seeing you. So take a look at your camera there. Something's blocking you. There you go. Thank you. Good morning, everyone, and welcome to our spring CCP, even though it's looking very winter-like. Jeff's got more introductory comments, so I'm not going to take very much time. I just am so happy to be with you, and hopefully this is the last virtual event that we'll have to do of this kind, and we can all be together again like we used to be, live, if that is appropriate for you. But before we start, I wanted to just take a moment of silence for the people of Ukraine. We here at Elville and Associates have some beneficiaries or quasi clients of ours that are in Kiev right now, and they're hunkered down and they're very brave, and they're doing all the things that we've been hearing on the news from all the very brave Ukrainian people, and they're not leaving, and they are staying, and they're going to take the consequences, whatever they may be. And so they are in our thoughts and prayers, and we know that many of you know people that are there. So let's just take a few seconds in silence, if we would. Okay, thank you everyone for that. And I think we'll just go ahead and move on now. Gary, do you have any opening comments?
First of all, I got to tell you, I'm really excited about the speakers we have this morning. It's one of the first events that our two firms have put on when Steve and I can just sort of sit back, relax, and watch the show. And second of all, I got to tell you that with all this bad news, the good news is we can finally, in just a few weeks, say play ball. And in honor of that, in honor of the lockout being canceled, I decided to dedicate at least my background to some famous baseball players. So let's play ball, and I'm really looking forward to this morning.
Well, thanks, Gary and Steve. So as always, we have much to cover today, and we're going to end on time. Our first presentation will be led by Jill Rosner, a registered nurse and certified aging LifeCare Manager with Rosner Healthcare Navigation, who will be discussing an overview of MOLST, medical orders for life-sustaining treatment. Jill, I'll turn it over to you, and thank you for being here. But first, I'll say that we currently have everyone on listen-only mode. However, when we take questions, we can then have you either type your questions in the questions panel as always, and I will also unmute everyone as well if you'd like to speak in your microphone to pose questions at that time. So I'll let everybody know when we have the option to do that. So thank you very much, and I'll turn it over to you, Jill.
Thank you. Good morning, everyone. I know it's challenging when we're all virtual and we can't see each other and be together, but I want to welcome everyone this morning and thank you for being with us. And you're probably glad we're virtual given the weather outside. I do want to get started and jump right in because we don't have a lot of time and I can really talk. So wanted to talk to you this morning about a MOLST form and how the MOLST is different from advanced directives. And usually when I'm with people in person, I do have a show of hands to ask who has already completed their advanced directives and living will. And usually I'm a little surprised by the amount of people who haven't done that yet. So I just wanted to share a little anecdote with you about a client of mine. She's 85 years old, and we talk about her advanced directive. She's had some health issues. She's had a stroke. And when I talk to her and I say, you know, what are your wishes? She says to me, I did my advanced directives 30 years ago, and you know what? It didn't make me die one day sooner. And so she's a funny lady, and she always shares that with me when we talk about any changes to her advanced directives or MOLST form. So I just want to really encourage that all of you speak to your attorneys. And if you have not written your advanced directives, living will at this point, that you go ahead and do that, because it's so important to have your wishes known. I always tell people, in the position, nobody expects the crisis. And when you get to that position, if you're not able to communicate your wishes and desires, then you will have done to you what other people decide. So it's important to pick your person who's going to be your healthcare representative, or healthcare POA sometimes it's called. But if you choose your healthcare representative and they are aware of what your wishes are, then everything is much easier. So the difference between the advanced directives and the MOLST form is that the advanced directives are done either with your attorney. Some people choose to do other variations, whether it be 5 wishes or they go online and find something. But if you have an advanced directive prepared by your attorney, it's a legal document. And it's not any order. It's a directive of what you would wish to happen if you were in specific scenarios. Whereas the MOLST form, which stands for Maryland Orders for Life-Sustaining Treatment, is really a set of orders, medical orders, for the paramedics if they come to your house, or physicians, or people in the healthcare field if you're in a rehabilitation facility or assisted living or long-term care, for them to follow so that they can really adhere to your wishes and your desires. So in other areas of the country, in DC, right around the corner in DC, they are referred to as the POLST, Physician Orders for Life-Sustaining Treatment. But essentially the same thing. So the MOLST is very specific, and the reason that we have a MOLST is because it replaces what used to be called the DNR, or do not resuscitate. And some of you, if you've had aging loved ones, or people who've had a life-threatening illness, they may have remembered seeing those posted on the refrigerator, so that when the paramedics show up at the home, they are very clear on what they should do. If someone is having a cardiac or respiratory arrest, they know how to treat that and whether to do anything for that. So with the Maryland Orders for Life-Sustaining Treatment, we tell people when they're filling them out that they should place them on the refrigerator if they're in a situation where there may be question about what to do. Now, not everybody fills out a MOLST. So if you're young and healthy, most of us don't have a MOLST form. However, when you become Medicare eligible, oftentimes when you see your physician and you have Medicare, they do a Medicare physical, and that will be included, that they talk to you about the MOLST form, what you would want. And just as the advanced directives, it's very important to update your advanced directives. It's very important to update your MOLST from year to year. Because if, as for example, I had advanced directives when I was pregnant with my second child, that's when I decided that I would want people to know if something happened to me, what to do in that situation. Now, as you age, your wishes change, and as you have health issues, your wishes may change over time. So it's very, very important to update your advanced directives. I can tell you that I had a client who filled out his advanced directives with his attorney when he was young, and he wanted everything. He never updated them, and so when it got to the point in time that they were talking about dialysis and he wasn't able to participate in that discussion, it became difficult because he had many children, had many different thoughts. So I want to go through the MOLST form with you so that you understand, and you may not be to the point in time where you're looking at a MOLST form, but you may have family members, parents or siblings or other family members where you need to know what this means. So you can see there's the 10 things everybody should know. I'm going to skip over that because you can read that yourself, because I really want to get into the heart of the MOLST form. So the MOLST form comes with an instructions sheet. It's called the Healthcare Decision Making Worksheet. And we ask patients, clients, to look at that sheet and read over that to help them make some decisions. When you look at the actual MOLST, which you're looking at now, you can see the little hashes there that there's ability to put initials in there. So when you're initialing that, that is initialed by the physician, the nurse practitioner, or the physician's assistant. Those are the three people who can actually sign the MOLST form. Now, they're signing that based on your wishes, unless in the situation where you have an advance directive and you have a healthcare representative and one of these forms has not been filled out then yet, that person who you have designated as your POA or your healthcare representative is then the person who can fill it out. So you can see under the certification for the basis of these orders, it can be the patient, if you're in a position where you have capacity to sign that, the patient's healthcare agent, as named in the advance directive, the patient's guardian of person, which is granted through the court, or the patient's surrogate. So I just want to talk about surrogacy for a brief moment. There is a list of surrogates. If you do not fill out a healthcare power of attorney or representative agent, then there is an order in which if there's no one designated, that people can make decisions for you. It usually starts with spouse, and then it goes to adult children, all the way down to, I've had clients who have no family members, and then it can be a friend even. So there is an order of who can make healthcare decisions for you if you have not designated that. But that's why it's so important to designate an agent or representative so that you know who's making your decisions and they know what your wishes are. So you can see that there's a list that says who is actually making this MOLST form, who is actually making the decisions for this MOLST form. So the orders should be consistent with your advance directives, and that's why it's so important to update your advance directives. So when you or someone who has been designated, in the event that you're not capable of filling out this MOLST form, when this MOLST form is being created, it should be consistent with your advance directives. If your advance directives say, I want you to do everything, and people usually fill out their advance directives based on their wishes, but sometimes it's religious preferences, any kind of cultural preferences. Those are what determine what you're going to put in your advance directives in those cases. And so it's really important that you are consistent, because if we look at your advance directives and it says do everything, and then someone's deciding for you because you don't have capacity to fill out this MOLST form, that based on your advance directives, we should check off everything. We should do everything. It's important that they're consistent. So if you're filling out your own MOLST form, you need to look at what you've said in your advance directives, and if you no longer feel that way, you need to change your advance directives also. So if you look under CPR status, this is really for when the paramedics come, or if you were to say you were having major surgery and then you went to a rehab facility afterwards, or even if you're in the hospital, this is on the front of your chart. And if you have a situation where your heart stops beating, or you're not breathing in respiratory distress or respiratory failure, they would look at the MOLST form. It's very easy. The reason there's a MOLST is because people don't have time to read through advanced directives and interpret them. So this is a very easy go-to. It's on the refrigerator or on the front of your chart, so that they know if your heart stops beating or you're in respiratory failure, what do we do? And the first one is attempt CPR. So that's do everything. That means if your heart's not beating or you're not breathing and you still have a heartbeat, they're going to do everything. They're going to do CPR chest compressions, and they're going to put a tube down your throat and start ventilations and put you on a ventilator. The option 2 is no CPR. That's option A, efforts to prevent arrest. So that means you're still breathing, but you're still, I'm sorry, you still have a heartbeat, but you're not breathing. And they would go ahead and put a tube down and start breathing for you. And oftentimes that prevents the heart from stopping beating. And so they would go ahead and start ventilating you, and to keep your heart beating and to keep oxygenating you. Option 2 is do not intubate. So they could use a mask, or they could use BiPAP or CPAP. And some of you may know the word CPAP if you've seen someone have a CPAP machine for sleep apnea, or you have one. You know that that's a machine that continuously pumps air into your lungs to keep your lungs open so that you don't stop breathing. So that's option 2. Don't put a tube down, but you can use a mask, or you can use BiPAP or CPAP. Option 3, no CPR. So this is really where it comes into the do not resuscitate orders that used to be posted on people's refrigerator, perhaps, or on the front of their charts, that if something happens and there is arrest of cardiac arrest or respiratory arrest, the person just wants to be kept comfortable. Just use palliative care and do whatever you can to make them comfortable, but don't and allow death to occur naturally. And so that's really oftentimes when you fill out this form, maybe they'll only do the first page. You know, do you want CPR? And then if you look at the next page, and we will have time for questions. So if you're thinking about things, just make a note and we'll go back and talk about them. Under artificial ventilation, so we talked about that. Do you want to be intubated and artificially ventilated indefinitely? And this is a situation where maybe, for example, one I can think of is someone has a massive stroke and their heart is beating. They may need ventilation. This gets a little tricky, and we'll talk about that with COVID. COVID has kind of put a little bit of a slant on this about whether or not people would want to be intubated. So somebody has a situation where the heart is beating, they get intubated, and they're on a ventilator. Well, this says you can do that indefinitely. And I think that one of the cases that you might remember, in I don't know how recent history, but in history, is the Terry Schiavo case, where Terry was a young woman who had a cardiac arrest. She was resuscitated, she was ventilated, she was put on a ventilator, and she was living in a nursing home on a ventilator. And then it came down to her husband saying, I want her off the ventilator, she wouldn't want to live this way, and her parents saying, no, we want her to continue on the ventilator. So, and actually that may have also included tube feedings. We'll talk about that. So this is one that, if in this situation, if you know that you have a life-threatening illness, and that may be an issue in the future, that you need to think about. Would you want to live on a ventilator if you could not breathe on your own? And that would be the case too of Christopher Reeves, who had a spinal cord injury. He could no longer breathe on his own, but then he did live on a ventilator. So there are times when that would be appropriate to look at, would you want to live indefinitely with a ventilator? The next one is you can use ventilation and intubation, but as a therapeutic trial. And sometimes people will write that in for a family member in the case where maybe they've had something like a stroke. There's a chance that they may recover, but it's too soon to tell now. And they may say, okay, let's put them on the ventilator now, but we don't want to we don't want to continue with this forever. If they haven't improved in 2 weeks or a month, and it's up to the person filling it out or you to decide what the time limit is reasonable, then we don't want to continue. Third option is CPAP or BiPAP. We've been seeing a lot of CPAP and BiPAP being used in COVID cases, and that's using a mask or nasal prongs to give oxygen continuously and it's pressurized, so it's more than just regular mask of oxygen. That's pressure being delivered. And then the last one is do not use anything. No CPAP, no BiPAP, no intubation. Okay, so then next, blood transfusion. And so really, we start to see these next orders really being utilized in nursing homes, in hospitals, nursing homes, and assisted living. I see these frequently with people who are in long-term care or assisted living. Maybe they have a chronic illness. Oftentimes they have dementia, and we're going to talk about that specifically when I get to the end of this. So if you have a problem that is causing anemia and your blood count is low and maybe your oxygenation is low because of that, do you want to get a blood transfusion? Some people will say absolutely. And then other people will say, you know what, if I'm in a position where I am dying, and it's consistent with my advanced directives that I have perhaps a life-threatening, life-ending illness, I don't want even have blood. I don't want to continue to sustain my life with treatments. Hospital transfer. This is really a situation where we're seeing this in assisted living, or rehab stay, assisted living, or long-term care, where in long-term care, maybe someone has been very ill for a long time. Maybe we're even doing hospice care, and it's no longer appropriate to transfer to the hospital. Hospice care would come to the home or to the assisted living or long-term care and take care of the person and not transfer them. So they get their care brought to them and they don't go out to the hospital, unless if you transfer to the hospital for severe pain or severe symptoms uncontrolled, then they would only send you out to the hospital if, for example, the best one I can think of is a hip fracture. There's a lot of people who I work with, they don't want it, their families, or they have said, I don't want to go to the hospital anymore. I'm tired of going to the hospital and I don't want to be put through any more treatments or tests. So they'll say, do not transfer to the hospital, but sometimes we have to. If someone falls and breaks a hip, that's very painful, and that cannot be managed in an assisted living or a long-term care setting. And for pain management and really diagnosis and treatment of that, we need to send them off. And then do not transfer to the hospital, but treat with options available outside the hospital. Sometimes, for example, I recently had a client who really, because the hospitals were so packed, she was in Sykesville and they were going to take her to Gettysburg. And I was her power of attorney, and they said to me, do you want her to go to Gettysburg? And I said, can we take care of this? Can we get an IV in her where she is the long-term care? And they said yes. So we treated her. She had an infection. We assumed and suspected she had an infection. They wanted to send her to the hospital, that it was reasonable. But then when we got into, we're going to have a transport from Sykesville to Gettysburg. Family's not going to be able to, well, it was a difficult situation. She had a child who was not going to be able to see her. So we decided that, no, let's treat her where she is, and they were able to do that. So we said, okay, we're going to stay put. Antibiotics. This is, you can use antibiotics and you can get oral, IV, or intramuscular, and we'll talk about that again. You can use oral, but do not give IM or IV. You may use oral antibiotics only when indicated for symptom relief or comfort, or do not treat. I see this, we get into this a lot with people with dementia who maybe have a urinary tract infection or pneumonia. And it really depends on what usually the family wishes. I had a client once who the family had checked off, you can give antibiotics, but just orally. Well, he clearly had a life-threatening UTI. The symptoms were very pronounced with that. They didn't want him transferred to the hospital. They said only oral antibiotics, but we couldn't get him to take them. So they really had to change the MOLST to say he could get an IM shot for antibiotics. And sometimes that happens. Sometimes they do change, but then sometimes people say, we're not going to treat this. This is not the way that they would want to live. They didn't want this, and we're not going to do that. So, and then I do want to go back to the may use oral antibiotics when indicated for symptom relief or comfort. That's oftentimes in the case of hospice care. If someone has urinary tract infection and it is causing them pain and discomfort, we are not treating that to correct any other illness or disease process. We're really treating that for comfort and symptom management. So, artificially administered fluids and nutrition, this is always a tough one. And I can tell you this is probably, in my experience as being a nurse for 39 years, the one that causes the most distress within families. So we may give artificially fluids, meaning IV fluids, and nutrition, meaning tube feedings, indefinitely if medically indicated. Now, if someone needs a tube feeding, artificial tube feeding, that means it may initially be a tube down the nose into the stomach. It oftentimes means putting what we call PEG tube, a surgical insertion of a tube right into the stomach. And this is where there's a lot of distress with families with this one. May give artificially administered fluids and nutrition as a trial. So we say, okay, and I can give you a perfect example. Worked with a family, 60-some-year-old gentleman, had a massive stroke, couldn't eat, had a tube feeding until he was able to regain his swallowing. May give fluids for artificial hydration as a therapeutic trial, but do not give artificially infused nutrition. So some people say, yeah, I want my loved one to have an IV and get IV fluids and antibiotics and anything they need. But if we get to the point where they need a tube fitting, we don't want to go that route. And then do not provide any fluids or nutrition. So the reason this one's always tough is because if you are not clear up front on what you absolutely will and will not accept, then I had a family of 9 children. Mom had pretty much end-stage dementia. Some of the children felt that it would be killing mom not to feed her. It's a natural process with dementia. People stop eating at some point. And some of the children said, we are absolutely not going to let her starve. We're putting a tube in. And she got the tube put in and she ripped it right back out. And so typically that doesn't work very well with somebody who has dementia. So that's oftentimes a really divisive in families. That's really a hard choice. So it's really important for people to make their wishes known. And then dialysis, may give chronic dialysis for end-stage kidney disease if medically indicated, may give dialysis for a limited time, or do not provide dialysis. Again, for somebody who may have an end-stage disease or dementia, that is oftentimes one of those conditions that there's disagreement with. I see that less often than tube feedings. Other orders, you can write in what your wishes are and clarify anything that may be unclear. So I just want to talk about dementia for a minute, because I really see a lot of people with dementia, and that's really sort of my forte. And I want to say that with dementia, it is very important to make your wishes known, and I always let people know that they should fill that in that little other orders, and make it clear, and make it clear when you're filling out your advance directives that what would you want if you can't choose anymore. And this becomes an issue because some people say, if I'm no longer able to care for myself and my bodily functions, and I cannot complete my activities of daily living without anyone else helping me. If I can't eat and drink by myself, I do not want any intervention. And it has to be clear, because I've worked with physicians who do not feel that dementia is an end stage or uncurable disease, and they don't think it fits into the categories of advanced directives. And so they will argue that we're not in one of the conditions that says don't do everything. So it's really important to include some reference to if you should be cognitively impaired and not be able to make your decisions, what you would and wouldn't want, because they don't always fit into the criteria under the advanced directives living will piece. So, all right, I know I raced through that. I'm going to take a breath, and I really like to hear questions and see if anybody has any thoughts.
Well, thank you, Jill. I'm going to go ahead and unmute everybody. So if you have some comments for Jill or questions, feel free to go ahead and speak into your microphone, or you can go ahead and type them in the questions panel as we've done in the past. So we do have a question here that's been typed in, and I'll go ahead and read that now. So why is the form signed by the practitioner and not the patient?
It is reviewed with the physician, and it's considered an order. So Maryland orders for life-sustaining treatment. It is signed by the physician who has discussed with the patient what their designated person, what their preferences are. And that's the way it rolled out. And I think the DNR was the same way. The physician had to sign off on that. And I think it's also a safeguard so that people didn't just make their own and stick them on the refrigerator, you know, for mom or dad or whoever with their own preferences. And so, and I also want to say that people should be completing this at a point in time that they have capacity. I've seen physicians go in and talk to people who have dementia already, who think part of the process of dementia is oftentimes people think they're much younger than they are. So if you ask an 80-year-old person suffering from dementia, do you want to be resuscitated? And they think they're 45, of course they do. And their advanced directives may say absolutely not. But now they're impaired and they're answering a physician who probably shouldn't be asking them. Hi, it says I'm being muted by the organizer.
I apologize for that.
Okay.
Go ahead, please. I'm sorry.
At what point did you lose me? Because I thought I was talking and then I just got a little flash that said being muted by the organizer.
About the last 10 seconds. I apologize for that.
Okay. I'm not quite sure what you didn't hear, but we were talking about if you have dementia and the physician's asking you when you were already impaired if you would want to be resuscitated, then most people will say yes, and that's not consistent with their advanced directives. So we have to be careful about that. Are there any other questions?
Jill, I don't want to get in the way of anybody's questions, but I think you did a wonderful job here this morning of giving us perspective, but also to get to the heart of something I know a lot of people are concerned about, which is who certifies this form? You know, who's filling it out and who's certifying it? And you clarified that a lot. So could you speak to that again before you wrap up? You know, and the second question I have is, it seems that you're saying that we should be thinking about a MOLST form, not just the fact that it's required by Maryland if we're in a facility, but we ought to be thinking about it even if we're not in a facility.
Exactly. Now, if you go to the hospital and you're young and you're having a routine surgery, you're probably not going to be asked to fill out a MOLST. Some people may, and oftentimes I don't see my patients having MOLST. But if you are going to the hospital with a life-threatening condition, if you're aging, they will usually ask at the bedside to have a MOLST filled out, and the doctor will do it at that time. Sometimes people already have it and they bring it with them. Certainly if they're transferred in from a long-term care or assisted living facility, they must arrive to the hospital, hopefully with one in hand, and it should go back with them. And it is filled out by the physician, usually your primary care physician, in an office visit. Again, the Medicare yearly exams usually encourage the physician to have a MOLST filled out. I know that's been an issue with some of my clients because Medicare will not pay the physician for the time to fill out the form, and they oftentimes get a separate bill for filling out the MOLST. But at some point in the process of Medicare physicals, usually people at that point will start being asked by the physician if they want to fill out a MOLST form. Just remember, if you don't have anything, if you don't have any documents, if you don't have an advance directive, if you don't have a healthcare agent or representative named, or you don't have a MOLST, then no one will know what your wishes are, and you will be depending on someone else to make the decision for you. Does that answer your question, Steve?
Yeah, that's very helpful. I think there's and we don't want to get into Michelle's presentation time, but I just think there's a lot of confusion. We know the state requires it and under certain conditions. And then I think a lot of us and a lot of our clients think that if we are not in a facility, unless our doctor recommends it, we don't really need one. But this is what you're saying this morning tells us to be more proactive and not just to use a healthcare decision worksheet, but to actually talk to our doctor about whether we should have a MOLST form, even if we're healthy and well, not living in a facility.
Right, and that will change if you do fill out one, depending if you have a health issue that you are concerned about that there may need to be resuscitation or something. Even if you fill out one now and you check I want everything, then the paramedics, I know, I've been there, I've called the paramedics enough times from people's houses to know that that's the first thing they ask coming in the door. Is there a MOLST? You know, except for in the younger population, that is not usually the case, but in the aging population, that's what they will say. Is there a MOLST form? And if there isn't one, then everything is done. If there is one and it says do CPR, then it is clear we want you to do CPR, not start looking around and what are we going to do here, asking questions, looking for the people who are in the room. Do you want CPR? You know, that really, that can be changed just like the advanced directives, and it should be updated.
Very good.
All right,
Okay.
well, thank you, everyone.
Any
Thank you
final
so much,
questions
Jill.
for Jill?
Thank you.
Yes, thank you very much, Jill. Really appreciate that about this important topic. So if there are no more questions, we're going to go ahead and take a 5-minute break, and then we'll come back and introduce our next presenter, Dr. Michelle Fritsch. And then should time allow, Steve and Gary will be available at the end of our time together to answer any questions that you may have for them. So we will get right back to it in about 5 minutes. So if you could be back then, we'd certainly appreciate it. We will see you in just a few minutes. Thanks very much.
Hey, Jill, I'm starting to see aging. Aging doesn't mean 100 plus. Like I'm in my 50s, I'm starting to be asked these questions, right? So it's like all of us.
Right, right. I mean, it really, everyone should be doing advanced directives. Everyone, doesn't matter how old you are, everyone should do advanced directives because we don't have a crystal ball. And God forbid you have a stroke, or you have an early onset dementia or young onset dementia, or you have a car accident that leaves you completely in a vegetative state. You better have some documentation that says I don't want to live in a vegetative state, or yes, just keep me alive forever. And some people want that. And I see that. I see people that I work with who say, I want everything. And sometimes we certainly honor their values and their goals and their requests, but sometimes it's hard when someone's struggling and really in a position where it's really gets to the point where you know that they probably would no longer want to live like this, but they've made that request. So so I know aging, you know, you keep
that word.
You keep bumping up the age. What's the, I just want to share this. I taught a class at McDaniel College called Aging and Social Identity. I know that sounds like a snoozer, but I taught that class. And I asked my students, first class, I want you to draw a picture of what you consider an aging person to look like. And then I want you to tell me what number do you assign to aging. And that was really interesting because some of them said 50.
I know.
And one very insightful student said, well, I had two very insightful students. One said, at the point in time that you realize that you're a person outside of your parents and you start to have your own ideas, that is when you're aging. And someone else said, we're all aging every day. And I was like,
My grandmother at 97 said, don't you dare call me old. All right, good grandma.
And I see that all the time. People who you know, we were going to off to assisted living, and they say, I don't want to be there with all those old people, and they're like 90.
Zach, oh yeah, I've seen it too. Hey Jeff, can I get the slide control?
I'm going to pop off when we come back. I'm going to listen in, but I'm going to be off of the screen. So
good to see you today.
I look forward to your talk, and I look forward to seeing you in person at some point.
Sometime soon. Sounds good.
Thanks. Keep doing what you're doing.
Thank you. You too.
Thanks.
Okay, Michelle, you should have the presentation option there.
Excellent. Can you see it?
I can.
I need to get something out of the way. There we go.
Great. Looks good. Okay. So we'll give it another few seconds here.
Michelle, what does BCGP stand for?
Board Certified Geriatric Pharmacist.
Got it. So does that mean you have a pharmacy degree?
Yes, I'm a doctor of pharmacy, And then board certified, my specialty is people over 60.
Yeah, my brother's a pharmacist. So whenever we have medicine questions or what does this do or that do, we always call Jamie.
That's where you turn. I've got a lot of people that use that option.
But I find sometimes she knows more about the medicines than the doctors do.
We have a lot more training about the medicines than any other health professional, like a lot, like 4 times more.
Yeah.
Michelle's resume is about 25 pages long, Gary.
Oh, really?
It is. And I'm going to go through every page right now, actually.
Excellent.
Single space or double space?
It's actually single. So let me go ahead and get started with that being said. So welcome back, everybody. Our second presentation is an interactive discussion led by Dr. Michelle Fritsch. Just like Jill, a friend of the firm at Elville and Associates here, she is a board-certified doctoral trained health professional who has presented with Elville and Associates several times and is known throughout the country for her knowledge regarding health and wellness in retirement. Michelle will discuss beyond coping and COVID and world events, ways to thrive. Dr. Fritsch has the capacity to discuss health on many levels: physical, mental, emotional, spiritual, and social. She's been a presenter with Elville and Associates' popular wellness series webinars each of the past 6 months and is actually presenting again for a 7th time next Tuesday about brain health and wellness. So Michelle, I'll turn it over to you and thank you for being here. Before we do that, I will just say again that afterwards we will turn it over to Gary and Steve for some final comments and questions that you may have for them. And the last thing we'll do is I'm very excited to announce some information about our 2022 spring annual client event. So Michelle, it is all yours.
Thank you. Thank you, Jeff and Steve and Gary. I am so honored to be here. And as you all can see in the title, when we named this, COVID was the big elephant, the big thing everyone was thinking about. And in January, COVID hit its all-time high worldwide. And now we're not thinking maybe quite so much about COVID, although it's certainly not gone away. But there are so many other world events. So the goal today, a couple of goals. One is for you to move from coping to thriving. And hold me to this. I want you to have 5 strategies that you select out of today's presentation that you can use to help you navigate that transition. And just a little bit more about what I do, and we can talk about it at the end. But Retirement Wellness Strategies is a very exclusive process. I work with people one-on-one, typically before retirement, and then throughout it to have a rock-solid plan for health. But because there's one of me, I can only work with about 5 people at a time. So over COVID, with a colleague, Ellen Platt, we created Propel Comprehensive Wellness so that a lot more people can have that process through a subscription program with pre-recorded videos. So I will tell you a little bit about that at the end. But my passion is that we not lose people after retirement due to lack of planning, but rather not only stay healthy, but have a real sense of purpose in that next phase. So let's dive in. I've seen too many people with the events of their own life and kind of losing track of who they are or having their world feel out of control. And now with the events beyond them, too many people living in misery, and then health declines rapidly. Then there's a group of people that learn to cope. So they kind of hold it together. They keep going day to day. But then there are the people who are thriving, who have figured out how to, in spite of the things happening around them, continue to be present, to be their best self, and to really be there for others. So that's my goal for you. So I want us to think about, well, what are health and wellness? And I'm going to cheat a little bit. The Global Wellness Institute says that wellness is the active pursuit of activities, choices, and lifestyle that lead to a state of holistic health. So health is kind of how you're feeling and how your body is functioning. But wellness gets into, well, what are you doing about it? What choices are you making to maintain and improve your health. So I want us to do a brief personal inventory. Just take a minute and think about, at this moment, this week, or even this day, how is your physical health? What is going well? What do you have a plan to manage, even if you have a diagnosis? And what are new things that have cropped up that maybe you haven't even dealt with yet? And then how about your personal mental health? How are you coping with anxiety or symptoms of depression? Are those things active in your life right now? Social health, all this talk about social distancing, and that's really, in a way, the last thing we need. Physical distancing can protect us from COVID, but socially, we really need each other. So how are your social circles? How many relationships are key in your life? And then emotionally, as news comes in, as Steve was saying, we're just devastated by the things happening in Ukraine. Are your emotions all over the place? Are you riding a wild roller coaster? Or have you found ways to process those things and maintain closer to a sense of calm? And spiritually, whatever that looks like for you, there is a lot of data that we are spiritual beings and we need to express that. And again, I'm not going to dictate how you do that, but I have a lot of clients who try to just ignore that part, but it is a part of your overall health. So I hope this has been helpful, kind of figure out where you are right now, because now we're going to talk about ways to hopefully make it all even better, or at least maintain it as time goes on. We'll come back to this later, but there are so many ways to take care of yourself, to stay healthy physically, to avoid viruses and fight viruses, but also to stay mentally and emotionally and spiritually more grounded. One is getting plenty of sleep. I would say at this point in our world is not the time to try to pull all-nighters or do things that you're, what do they call it, burning the candle at both ends. It's not a good time for that. We all need our immune systems to be strong, and we need to give ourselves those opportunities to rest. Avoid triggers. Try not to go and do things or spend too much time around people that you know just sort of put you on edge. Movement is key. Whether you go to the gym or you walk or you do yoga, movement is so important for your whole body and your whole being. Music, sometimes it's fun music, music of your generation that you really like, and sometimes it is calming music can make such a difference in helping us through difficult times. Being out in nature, maybe not today, but in other times, being out in nature, there's great data that just being out among the trees and the fresh air, one, it helps you sleep better, but it also brings out endorphins that just calm you. And then there are a number of relaxation techniques. So we're going to practice just a couple today, but there are so many more. So lots of ways that you can help take care of yourself and then encourage those around you, those that you love, to engage in these things with you. So we're going to try something right now. I want you to stand up and just really stretch. If you haven't done this yet today, really, really stretch. Work out the kinks. And as you do that, I want you to breathe deeply. So you're going to take your breath in through your nose, but do it slowly. Again, as you're relieving all the tension in your body. And then out through your lips like you're breathing through a straw. So again, just stretch your body, really stretch, make it feel really good. And take 3 of these deep breaths. The beauty of this type of breathing is when we feel ourselves really getting anxious and it's ratcheting up, this kind of breathing, even if you're in the middle of a board meeting, or you're in the middle of a conversation with someone. They don't have to know what you're doing, but it's amazing how you can bring yourself back down and calm down just by paying attention to a deep breath in, fill your chest, fill your belly, and breathing it back out. It can keep you from going over the edge, getting angry, blowing off steam, crying. It can just really help to calm you, that breathing. So we're going to go a little negative for a minute, but I promise we'll come out the other side. In addition to all the stresses we've always had in life, just imagine what we're dealing with right now. COVID has not gone away. Thankfully, it's not as big of an issue right now, but in January it hit its peak. Financial concerns, partly related to world events. Some people are dealing with serious health conditions. There's a lot of uncertainty. The supply chains are crazy. We may be having aging parents and friends and their conditions that we're trying to navigate. Do you ever feel like you're operating on the defensive and things are not as much in your control as you would like? Feelings of danger, lots of mixed messages. Depending on what news source you use, you get such different responses. You don't really know what's real, political unrest. And then I know I'm finding it difficult for the younger generations. How do we help them navigate and keep track of all of this? So much on our plates right now, making it more important than ever that we really take care of ourselves so that we can continue to be there for everybody else. So this is my diagram that I feel that the clients I work with and the family and friends around me, I see so many people in this cycle. So there's stress and there's fear. And that causes us to stress, eat, and drink. Be honest. Have you been stress eating and drinking over the last 2 years? Poor coping. Even if we were rock solid before, I know a lot of people are struggling to really maintain that sense of calm through all of this. Anger. Oh, the number of people who have what I call a short fuse. Little things that wouldn't have really bothered them before now can send them over the edge. And we're seeing it all throughout our society. And then sleep. Sleep is being disrupted, and there's so many negative effects to that. So when these things happen, blood pressure goes up. All of that stress and fear and anxiety drives up our blood pressure. Our veins and arteries squeeze together, our heart beats harder, our kidneys start churning out and reserving water just to help us for the future in case of whatever's coming. So we get into that panic mode, our blood pressure goes up because of partly the stress eating and drinking, but also the stress levels, our weight goes up. So then our risk of diabetes goes up. And then chronic pain, and we'll talk about this more in a second, but the more stressed out we are, the more anxiety we're feeling, the worse our pain feels. And that just goes back to driving the stress and the fear. So think about where you are in this. Maybe you've got just a little bit of this, or you're like, oh, this explains my last 2 years. We're going to talk about ways to break this cycle. So how do you handle stress? And stress can come in a lot of different forms. But what do you usually do to manage these things? And how are you coping with this now? Is it the same as it was in 2019? Or has it become more difficult to manage the stresses? There is a lot of data that negativity and holding on to negative things has a direct impact in poor health. And I've seen it, I was going to say hundreds of patients, but I think I've got to go to thousands who've had chronic pain conditions, but it's just not releasing this. So I read an article this week. I want to read this little snippet to you. Our refusal to forgive, which is a part of it, these things happen, and sometimes we feel like, or it is true that other people sort of made these negative things happen. Our refusal to forgive comes at great mental physical, and spiritual cost. Could it be that the physical aches and pains we experience on a regular basis are a residue of our refusal to forgive those closest to us, regardless if they ever admit wrong or even ask for that forgiveness? I will say in patients, and this is terrible, but I've seen it so many times, horrible things. People can hurt other people in terrible ways. People have been through abuses and traumas. And if they hold on to that, they never have a chance to talk about that and express it and deal with it. That comes out as tremendous pain and disease later in life. But the good part of that, if you will, is I've also seen people who've carried that burden for decades. And if they can now receive the support they need, their health improves, their pain management improves. So it's never too late to deal with those things. And forgiveness is part of it because it helps you more than, it's not really for the abuser, it's just for you to let go of things. So know that holding on to negativity has ruined many lives, but it can be turned around. A triad, a vicious triad I see so often is anxiety, pain, and sleep. When we're very anxious, pain feels worse and it's hard to sleep. When we're in pain, we feel more anxious and it's hard to sleep. And when we don't sleep, we don't deal with anxiety well at all or pain. So it's a vicious triad. I have found in the years with my clients, usually the easiest, not that it's easy, but the easiest place to break that is actually with sleep. So I've got just a few sleep tips here. And Jeff, I can post this for everybody. I wrote a blog about this and made some videos recently because it's such a big issue that can give you more sleep tips. But one is staying away from the news, the television, and the phone. Check on it as you need to, but not watching it all day long. And having more of that time outside where you're getting a break from all of that information. All the self-care that we talked about, and we'll go back to. The breathing techniques, clear your head. Try to just get away from it. Stop pondering it. Try to clear your mind. Let things almost reset so you can deal with things better. The stretching, maybe a warm bath or shower before bed, soothing music. This is not the time for the dance music, but the soothing music and the scents like the lavender sprays. Alcohol and substances, the use of those has exploded during this pandemic, but the sleep you get with sleep medicine, alcohol, or any other substance is not the deep, restorative, restful sleep that you really need. So I encourage you to not use any substances, not even sleep medicines. And then there are a number of sounds. If you've never experimented with nature sounds or ocean sounds, or there's colored noises, white noise, pink noise, brown noise. And if you're interested, again, you can get all of those through the blogs and such. A number of things that will just distract your brain, especially if you're a to-do list person like me and it just keeps churning and keeping you awake. Those sorts of things can distract your brain and allow you to get into that deep sleep. So sleep is very important. Now, I've had a number of people, more people say in the last 2 years than before that, oh man, one, I've lost my creativity. I've got no ability to think creatively anymore. And I'm really pretty sure my memory is slipping. And this is what we'll talk about on Tuesday, Jeff, if anyone wants to come to that session. But just to briefly go over it now, if you feel like your memory is slipping, the first thing we do is we look, there are a lot of fixable things that can make that better. So things like, are you getting good blood flow? Is your heart working well? Are your lungs working well? How about your vitamin B12 and your vitamin D levels? Can we amp those up a little? Are you dealing with depression? So many people are right now. How's your thyroid? Have you had that checked? Maybe adjusting that will help. And there are many, many, many medications that impact the brain. And I can tell you thousands of stories of just adjusting some medicines and people get their sharp thinking back. And any medicine that's drying, whether it's for cough and cold, or it's for diarrhea, or for anything, any drying type of medicine also really tends to make us not think so sharply. So if you're interested in having a review of that, just let me know, because medications can make such a big difference. But next, I'm going to tell you, I think the biggest thing that's causing the change in people right now, and that's our brain. If you look at that little brown dot, I call it the little walnut or the amygdala, it's down here in the base of your brain. That is what drives fight or flight. And when we were created, you know, as in our natural life as we're intended to live it, things are usually pretty docile and serene, and occasionally a bear tries to chase us. So the amygdala only needs to do its job when there's a bear and we're running away from the bear. And at that moment, the amygdala takes over all thought and puts all the blood to our muscles, and it's all about escaping. We've unfortunately entered a time in our society where some of us live in fight or flight all the time. And when that happens, again, the amygdala is making the shots, calling the shots, deciding what you're going to do. And it's all about self-preservation. But where we're supposed to be is this front part of our brain, which is so much larger. This frontal cortex part of our brain is where we're creative. It's where we make good, sound decisions. It's where we're able to think through complex things and figure out what's the best choice. So if you find people doing things that feel impulsive or not in their best interest, or avoiding things that could be really good for them, it's usually because that amygdala is driving. And if nothing else, by the end of today, I hope you have several ways of recognizing that, oh my goodness, I'm in that tense fight or flight mode. Calm that down, take the control back from the amygdala, put it back up here in your smart brain that is able to be creative and calmer and make good decisions. It's important for our whole society that we work with everybody to try to take control back from the amygdala and be that more thoughtful, productive, proactive thinking person. So we're going to try one more thing. We all need touch. One of the most devastating parts of isolation when someone's not around others is that lack of touch. So if you have somebody in the room with you, you can do this together, or you could do this for yourself. There are 3 areas that I think are the most calming that you can massage yourself or massage someone else. That again, it really helps calm the brain, calm your body, focus back on the smart part of your brain. And we'll continue the deep breathing we talked about before. So one is your feet. Foot massages are great. So I encourage you now, slip off a shoe, have somebody with you massage your foot or massage your own foot, or rub your head. I mean, I love having my hair done, and part of it is just having your head rubbed. So rub the head of the person next to you. Use your nails if you can. That is so relaxing. Or massage your hands. Massage your hand, massage each finger. And you might feel silly, but I encourage you to do this and just feel how much it takes your thought and focuses it on what you're doing and how good that can feel while you're deep breathing. And again, it's something you could do at a board meeting. Nobody needs to see what your hands are doing under the table. And so you can be massaging your hand and just using that as a technique to calm, to breathe, and again, to take control back from the amygdala and put it back in the front of your brain where you can make so much better decisions. Even if you're watching the news at night and you feel like yourself getting really stressed, and we just talked about, I prefer you not watch it at night because it's hard to sleep. But think about these sorts of things that you can do to help calm yourself back down so that you can get into that restful state. Thankfully, I talked about a lot of data on how the negativity and keeping that within us has such negative health effects. On the flip side, the positivity has beautiful health effects. Your immune system is so much stronger. You tend to live longer and feel better. So being engaged with other people, avoiding that whole isolation kind of scenario, being more optimistic, thinking about the good, positive things that could be happening, having your team of people, your tribe, people that love you, that whether they're physically with you or you can communicate with them on a regular basis, friends and support, so important. That ability to bounce back, knowing that the bad thing that happens doesn't have to be the end. There's a chance to come back, do it again, take a different approach. Conflict management skills, I would say pretty much nobody is really born with those, but that is something you can choose to develop, is how you deal with conflict, how you manage, how you learn to stay calm and rational and have an open discussion with the person with whom you're experiencing conflict. Again, I don't think anybody really is born with that, but you can develop it. There's a lot of ways to work on it. And then again, back to the spiritual part, if you have a sense of higher power, or just consider, where does your hope come from? People that focus more of their time and energy in this way tend to have a healthier life overall. Now, one really tangible thing you can do to enhance and manage your health long term is to collect all of your accurate health information and keep it up to date. So Jill was just talking about the MOLST and your plans for the future. I encourage you to also carry a list of every substance you take, everything you're allergic to, your list of your diagnoses, surgeries you've had. Pulling all of that together allows your healthcare team to make really wise decisions. I will say, after over 30 years in healthcare, rarely does anyone actually share with me the whole story, because there are so many things you can choose to take on your own, like vitamins and supplements. There are different sorts of exercises and acupuncture and so many different therapies people can pursue. Your healthcare team actually needs to know it all so they can partner with you to make good decisions, just like Elville and Gunderson are doing with you to make sure that you're together making really wise decisions. So in all of those key aspects of your life, make sure you're an active participant, asking good questions, asking for things to be reviewed, make sure it's always updated. So coming back to self-care, I'm going to pause for a minute. I want you to pick at least one or two that maybe you're not doing regularly that you could incorporate over the next few weeks. Ways that you could, again, really take care of yourself, because that's going to help you take care of others. And I'm going to pause here. And Jeff, does anyone have any questions? I'd love to hear your thoughts. Feel free to come on the microphone.
Well, I am going to go ahead and work to unmute everybody now, so please feel free to chime in. So I've got a message here saying I'm unmuting all attendees. Attendees will have full audio control and may unmute themselves at any time. So please feel free to chime in regarding anything that Michelle has talked about up to now.
Don't leave me in isolation.
Hi,
I'm still.
can you hear me?
Yes, go ahead, please.
This is John. The idea of a complete healthcare info, it's spread all over the place depending on
Right.
who I'm seeing. Is there some type of instrument that you're aware of that can prompt you so you get it all down in one place?
It's what I do with my processes. I'm not here to sell to you, but I will do that with you if you want to work with me. But that was the design between your MyChart or whatever kind of patient portal you have from your healthcare system. Usually somebody in the physician's office will work with you, that if it's not automatic that all your doctors from your various doctors information is coming together. There's a way that you can get copies of things and upload them into your patient portal. So that's one other way to think about doing that, because you're right, it's scattered, and that leaves every doctor at a huge disadvantage when making decisions about you.
Thank
It's a
you.
great question.
I have a question.
Uh-huh.
We thought about naturopathic person to see. Are you aware of that approach, and have you heard good or bad of it?
I'm very aware of that approach. Well, I'm seeing a growth in the number of practitioners who are talking about practicing functional medicine, which is similar to naturopathic medicine, where it gets down into more than here's the diagnosis, here's a medication. We know there's so much more. So naturopaths and functional medicine practitioners are going to help you dive down into what's underlying all of this. Sometimes it's that negativity that hasn't been released. Sometimes it's genetic factors that once we know them, then we can choose a healthcare plan for you that's specific to your genes. Sometimes it is all about the foods that you're eating and taking away foods that we know could have a negative effect on whatever problem you're dealing with, and replacing that with foods that would be better. Sometimes it's just teaching you how to manage your body better with like physical therapy. So all of those pieces and parts are good. Now, naturopaths, the limit to that is there are some things in the world that are true diseases. Most of those are infections, and those naturopathic remedies can't completely manage. So antibiotics will be the difference in life or death for some people with some of those sorts of issues. But for many other things, that naturopathic approach, especially maybe in combination with your primary care doctor, could be very effective.
We do have a question here that's been posed, and it is, what is your take on CBD and marijuana?
Oh, we could talk about that. I've got a 2-hour presentation on that. But in general, CBD is cannabidiol. It's part of the cannabis plant that we think has more of the therapeutic effect. And then THC, tetrahydrocannabinol, is the part that kind of makes you high. Maryland has legalized medical marijuana, and you can get a card, and there are many dispensaries. And then I think recreational will be on the ballot again the next time it comes around. For therapeutic purposes, I highly recommend more CBD and less THC. Now, there's one theory that says you need a little bit of both to get the ultimate effect. But I have found people my age and older, we need to start with a product that has very little THC, because otherwise it can cause that not so sharp thinking, not great control of our physically, increased risk of falls or injuries or car accidents. And so there are dispensaries here in Maryland that have medical directors who really take a more medical approach. And there are others that take more of a recreational approach. I would recommend, if you want to try it, choose a dispensary that takes a more medical approach so they can put it in the context of the rest of your health. Make sure we're not creating more problems with any of your diagnoses or interactions with your medicines. In addition to just helping you choose the right kind of products based on what you're trying to accomplish. Now, there are a lot of things you can buy that say they're CBD that you can buy at the Exxon station, or you can buy at the health nutrition store or online. I will tell you, nobody's regulating that, and I've got two colleagues in particular that have been researching those and measuring what's actually in there, and it is all over the board. So I don't have a lot of trust in the stuff you can buy on your own, but through the dispensaries, you can get CBD only products that are measured, and we know what they are. If you want to buy it on your own, go to the company that's making the product you're looking at, to their website, and many of the ones are the ones that I would recommend are choosing to allow their product to be tested. Just nobody's regulating it or requiring it. They're choosing to do that and then share that with you as the consumer, that they have been tested and what they say is in the bottle is what is in the bottle. So if you're going to buy it on your own, at least I would encourage you to look at that.
Great questions.
Yeah, they are.
That's very good. Thank you for your valuable inputs. So,
Welcome. All right. So anything else? We can keep moving?
it looks like we can keep moving unless there are any other questions or comments. And thank you for the comments. I'm actually glad to see they work. It works.
Yes. Excuse me, can I have one more question?
Yes.
Just one
Please
other
go ahead.
question.
Okay, along that line of the naturopathic, how do you find a good one, or could you know any that you would recommend?
I think the question was, when looking for a naturopath, how do you find a good one? Was that
Yeah.
correct?
Yes. And I wonder if you can recommend anybody.
Trying to think how to answer this most correctly. Certainly look at reviews about the person. One of the things that I have found with naturopaths is some have some what I would consider out of date ideas. And so I would perhaps in interviewing a practitioner that you're considering, ask how they're keeping up and sort of the sources of the information that they're using. In licensed medical practitioners, there are requirements for continuing education so that they're aware of new knowledge that's being accumulated. I've not always found that with my naturopathic colleagues. So in my mind, that's what differentiates somebody that I might select. So I think that's that it's very fair to interview people that you're considering until you find that one that you feel like is a good listener and is keeping up and is able to really kind of relate to the problems that you're bringing their direction.
Okay, and do you expect them to charge you for that interview time?
No.
Okay, thank you.
You're welcome.
This is John again. Do you have a philosophical take on supplements?
Most supplements, if we don't need them, our body gets rid of them. And so most of them, you're not necessarily going to cause trouble by using them because your body knows what it needs. It'll keep what it needs and it'll get rid of the rest. But saying that, there are some that our body tends to hang on to. Not very many cause real toxicity, but I would encourage you to run your list of supplements past your pharmacist. Between our brain and our computer, we can look those up and just double check for you that they're not going to interact with your medications, because every substance can interact, and that it's not one that you could potentially reach a level of toxicity.
Thank you.
Like even vitamin D, for a while, we thought it was perfectly safe, take as much as you want. But now there's some data that you can overdo it. So I think as we use these supplements more, that kind of data will be collected and we'll understand them better. These are great questions. All right, I'm going to cover a couple more things and then I would love to have more questions for the time we have available. I mentioned at the beginning that knowing your purpose in every phase of life, and it can be very different, I have found to be very closely aligned with the people that stay really healthy and fulfilled. and the ones that just try to keep themselves busy. And I've seen a number of people, they're just looking for activities just to make the day go away, you know, just to get through it. That's not a great way to live when there's a way that you could be really fulfilled. And so this quote is that people who labor all their lives but have no purpose to direct their thoughts and impulses toward are wasting their time, even when they're hard at work, working hard. And I know people, they're working so very hard, but it's not really for a reason, and they're not as fulfilled. And notice that this was written in AD 121. So perhaps there's nothing new under the sun. Still the same kind of issues are around. So what do we do about that? I work with people who are nearing retirement, not quite there yet. And a lot of times people will come and they're like, I don't know if I'm even gonna retire. I don't know what I would do with myself, or maybe 5 or 10 years. But I think of it as a muddy windshield. I hope when the windshield's muddy, you're not gonna push the gas accelerator because you can't see where you're going. But with a process to uncover, well, wow, what could I do with my life in the next phase that I would really love? Then you're clearing that windshield. You can see that bright day ahead. And so most of the people that work with me actually move their retirement closer because now they can see it coming and they're really excited to get there. So one of the reasons, I've been in academia and healthcare all my life, and I left it because of these scenarios, especially people who are more educated and or have leadership positions or entrepreneurs that started their own business. Those seem to be the people that I see struggle the most. They've had a very successful career, super smart people, and then they fall into one of these pitfalls. And about 60% will find themselves with rapid health decline. Man, they seemed fine when they were still sitting in the boardroom, and they retire and their health plummets. The divorce rate in people over 50 has gone up substantially, and it continues to rise. I think there are a lot of reasons for that, but a big one is lack of planning. Have you talked to each other about what you want in that next phase? I can give you so many stories of executives right here in Baltimore who, at some point in their life, they had talked about these things and they thought they were on the same page. And then when the day of retirement came, they realized that was no longer the case. Like one of them thought that they were going to move to a certain area with certain activities, and the other one's like, I will never live there. Or one of them, they've talked about travel, big travel, going all over the world. But then grandkids were born. And so one wants to travel and the other one really wants to stay close to the grandkids and maybe even be a provider for the grandkids a couple days a week. Another one that I'm thinking of was a healthcare executive who had worked incredibly long hours every day for 40 plus years. And when he got home, he thought, well, she's been waiting for me. This is going to be great. And she's like, I've got a life. You're not hanging around this house all day. And so that communication prior to retirement can be a huge saver, if you will, of divorce. Because sometimes this goes back to conflict management. When we see conflict, it can feel easier to run away. Well, we're just not meant to be together anymore. Let's just end this right now. But boy, talking to people who've chosen to separate at that point, it does not get easier. The havoc it wreaks on the kids and the grandkids and the friend relationships in so many ways. It's actually worth it to work through that conflict and figure it out for many people. And then I've mentioned at the beginning misery. I've seen too many people who were very successful. People knew them as Dr. So-and-so, or as the community's, lawyer, or as the hardware store owner, or as the something. They were a person that everyone knew. And then they retired and completely lost their sense of self. It was so wrapped in that career that they kind of don't know who they are anymore, and they feel like the people no longer hold them in regard and no longer find them important. And I've seen that cause this very dark circle of despair where people become either little shells of themselves. You don't hardly even recognize them anymore, or they're angry or sullen or depressed, or I've seen too many suicides, and that number has been rising as well. So I don't want any of that for anyone, because I find that those are preventable. Almost always those are preventable. So that's why I left academia. I left healthcare to tackle this, because I found that with a really solid plan for how am I going to stay healthy, what do I need to do, how do I pull my health information together, how do I share it with all of the healthcare people that are part of my team, and that sense of purpose for that next phase of life, that's when people are very successful, fulfilled, life of the party, living past 100, really engaged with life. And when they're engaged, that impacts everybody around them. Their spouse wants to be around them more. their kids, their friends, they've got more social engagements because they're pursuing that purpose. Over COVID, I mentioned retirement wellness, where I work with people one-on-one. I have a colleague who is a colleague of Jill, Ellen Platt, who's also an aging life care manager. So I do the prevention part. How do we make a solid plan to prevent health decline through the process of retirement and beyond? Ellen does, like Jill, does the how do we prepare? How do we complete that MOLST form? How do we prepare ourselves for whatever comes next, that we're not in a panic mode, but rather we know where our resources are, who to call, what to have prepared, how to handle things, how to navigate the healthcare system. And so we put that together, and over COVID, we've been creating videos and workbooks for this whole process of what somebody would do one-on-one with me, and a lot of what they would do one-on-one with Ellen and her team, and allowed people to study it, if you will, and learn it on their own time. There are 36 modules plus some live webinars, an opportunity to meet with us one-on-one as needed, so that people can go into retirement prepared. Since it's 36 modules, ideally, people would do this 3 to 5 years before that date of retirement, so that they've got all their ducks in a row and they know what to do when they get there, and they can see that bright future that's ahead of them. Just a couple testimonials. Just sometimes people are like, yeah, I don't know about that. I've not heard of anybody doing that before. Does it really matter? So I wanted to read just a couple. One is, Dr. Fritsch took my menagerie of medicines and reduced my cost by thousands of dollars a year. That gentleman was a police officer in Detroit, actually. Another one, an automotive executive, said, Dr. Fritsch is my medical lifeline when traveling, both domestic and abroad. And so that's how he most uses me, as calls when traveling, make sure that he's got his health things kind of lined up and knows what to do if he runs into an issue. And this one is the funniest, I think. This is an executive from here in Baltimore. His wife signed him up, and he said, I don't have time for you. I have no desire to do this. And the last thing I need is some other woman yapping at me about what I should do or not do. So we started the process on his timeline, however much time he wanted to give me. But then he said, by the 5th session, these are my therapy sessions. This process made me think about, plan, and realize the importance of so many aspects of having my health in retirement. I did not have many of these pieces in my plan, and now I have implemented a wellness plan that I'm confident will allow me to enjoy a longer, happier retirement. So certainly why I do what I do. If I can help you in any way, let me know. Retirement Wellness Strategies is the one-on-one process. Propel is the monthly. I want to give you an option to try out a month of Propel for $10. But now I want to wrap up with us doing one more exercise. And then certainly if we've got time, take more questions. we're going to do the breathing, but I find sometimes it's easier to quiet your mind if you've got a favorite quote or song lyric or verse that you can recite as you're doing the breathing. And again, you can do this when you're caught in traffic. You can do this when you're in a stressful, contentious situation with friends or family. Nobody even knows you're doing it, but it's just a way to take yourself out of the situation a bit, take the control away from the amygdala, put it back in the front of your brain. So I'm going to give you 3 options, and certainly if you've got others that you like. I was trying to think about what are some fun song lyrics. So if you're a Beatles fan, we're going to breathe in with All You Need Is, and on the breath out, we're going to say love. If you're an Elvis fan, we're going to breathe in with Love Me. Uh-oh, I just forgot it. Love Me Tender, and out with Love Me True. And if you prefer a biblical reference, we're going to breathe in with Be Still and Know That, and we're going to breathe out with I Am God. So let's do 3 breaths. If you've got a favorite quote, you can do that too. But now we're going to breathe in and then hold it. And then out like through a straw. In. Out like through a straw. One more in. One more out. I'm going to turn off my screen so maybe I can see you all more. Is there a way I can stop sharing, Jeff? Okay.
Yeah, you've done that. Thank you, Michelle.
So I'd love to answer more questions.
Yeah, well, thank you so much. I'm still busy massaging my fingers. Actually.
Good. Doesn't that feel good?
It does feel good. You always have so much great information and then tips that I can take away. That's why I always love moderating our wellness series on a monthly basis and listening to you. So just thank you so much for some great tips and takeaways and information for our members today. So we do have a question here, and I am going to go ahead and open this up to unmute everybody again. So glad that we had some people chime in. Please do again. So everybody is unmuted for right now. But we do have a question that was posed a little while ago from a good member of ours. The question is, what do you think of glucosamine for joint issues?
It's a good question. And usually glucosamine is used with chondroitin. Studies have shown very mixed effects. The best research, if you will, about it has been for people with moderate degrees of knee pain. I don't know why, but I do know that you need to take it about a month before you get the full effect. And then if you, after a month, you're not seeing any difference, then there's probably no need to continue to pay for it. But if you feel like it's providing some relief, and then it's usually 1,500 milligrams of glucosamine. And so just make sure that the product you're taking has that amount.
Okay, thank you very much.
I was a long distance runner at one time. And after completing a few 50 milers, I felt pain in my knees and started taking glucosamine and chondroitin, and it made a lot of difference for me.
Good.
But I've also read that studies show it makes no difference. So you kind of take it on the fly. Also, I'm so glad you guys are talking about retirement today. I am retired, and one of the things that really helped me was a book called How to Retire Happy, Wild, and Free.
Oh, I love that. I've not seen that book.
Yeah, it has nothing to do with financial planning or anything, but as you indicated, for people, especially people who are type A, highly active while they were working, and then suddenly they just stop.
Yeah.
It's not good.
No.
So the premise of the book, as like you were saying, you need to make a plan in order to retire, and I highly recommend it.
And just a couple of examples, because you're reminding me, what you do in retirement that brings you joy might have nothing to do with your main occupation. So my favorite story ever is an airline executive who realized that he had recognized how important those first few weeks are in the life of an infant, and that infant needs that constant touch and nurture in order for the rest of their brain and their neurologic system to develop. But he also had a family experience where he knew that when a child's in the neonatal ICU, it's hard to be there all the time and still keep your job and work and such. So this airline executive goes to the neonatal ICU and rocks these infants when the parents can't be there. Talk about not related to your primary occupation.
Very nice.
I have heard that the people who have most difficulty with retirement are doctors, dentists, and attorneys,
And lawyers, yes. It's been my experience as well.
which is why I've been told by my wife I'm not allowed to retire.
But I had a lawyer here north of Baltimore who said they'll, and this is terrible, but he said they'll pry the keyboard out of my cold dead fingers. And that's pretty much what happened at the age of 88 or so. But maybe I'm putting my values on that person, but I feel like he never let go and got to do other things that he was working to accomplish.
Well, there's an expression among attorneys who talk about retiring and never wanting to retire. And if you speak to several attorneys, you'll hear this expression that they intend to die at their desk.
I hope you had lots and lots and lots of vacation time until that happens. Yes, I hear that more from attorneys than any other profession.
Yep. So Michelle, may I ask you a question?
Do you have any information on turmeric?
You know what? Turmeric, especially for the joints and such, there seems to be good information. It's hard to get enough in your food unless you've kind of putting it in every dish. So I know that there are a number of supplements out as well. I've not seen as such clear guidance on exactly how much and how often though with turmeric at this point.
Okay.
I do have a question here, Michelle. We have a person that's on the Propel website right now, and she says, is there a coupon code to get the $10 rate? Please advise. Thanks a bunch. I think there was a code. Can you provide that?
With an S, CARES.
Thank
and
you.
that's for the monthly. That'll bring the monthly down to $10 just to try it out. And I'd love your feedback.
Thank you.
Mm-hmm.
Michelle, if you don't mind my asking, how did you get into this profession?
Pharmacy or retirement?
Retirement.
I saw way too many people, and usually it was men, laying in hospital beds with things that I knew were completely preventable. So being an academic geek, I had to do research and figure out, well, what's being done about this? And nothing. So I had to try to figure out a solution. I couldn't stand it. And then again, the suicides just break me up. So unnecessary.
Can I ask a question, please?
Yes.
Please.
I would like to know I don't know anything about something, but my brother told me it helps with his like nerve pain in his feet occasionally. It's CoQ10. Can you tell me about CoQ10? Does it conflict with other meds, or what is it supposed to do? Blah, blah.
It
Thank you.
can conflict with other medicines, and so you do want to make sure that your pharmacist knows about it to make sure it's safe. It's, in general terms, supposed to make the blood a little more slippery, is the idea. And it's kind of like we were talking about with the glucosamine and chondroitin. Studies show that overall, a lot of people don't see a difference. But as long as it's safe with your other medicines and you do see a difference, you know, we're all varied from each other. It's probably not going to hurt anything as long as you make sure it's not interacting.
Great, thank you. Any other final questions for Michelle?
One last question. What's your take on the legalization of marijuana for social use in Maryland?
Keep in mind, I'm a healthcare practitioner, and so I've got that skewed view. When we legalized medicinal use, the growers had incentives to grow strains that had higher CBD and lower THC, which I highly recommend for therapeutic uses. As soon as it goes recreational, all of the financial incentive will be to grow strains that are high THC. And so I think our ability to access what we need therapeutically will be greatly diminished. And so that's my biggest concern. But also we know that car accidents rates will go up and that kind of thing. It definitely changes your thought process when you're actively using.
So does that mean you are for it or against it?
If I were voting, I would vote no, primarily because I don't want the therapeutic products to go away.
Thank you.
You're welcome.
Hi, I have a quick question.
Sure.
Thank you for the information, Ms. Fritsch. Very helpful and very timely, to say the least. But my question is, I'm noticing that there's a lot of wellness programs being implemented, like in the health facilities and at work and just all over the place. And I'm just curious, are they being like mandated to do this now? Or is this just something that, you know, our leadership is seeing that it's an issue and they're just trying to just make more effective programs for patients and employees? But I didn't know if there was a mandate to actually implement like wellness programs now.
I don't think there's a mandate, but when you think about the gigantic turnover in healthcare we've had before the pandemic in 2018 and 2019, I know some of the national medical and pharmacy associations were incorporating things because of the burnout rate. So they were incorporating wellness things for all these reasons we've talked about today, so that healthcare practitioners could do the stress of their job and still take care of themselves. And then COVID blew that out of the water. I mean, the healthcare industry has taken such a dramatic hit. It's been so hard caring for this pandemic that I think there's a recognition. Now we're asking people to come back into the office, but they're nervous. It's just, there's so much going on in our heads, so much stress, that they're seeing that wellness has got to be part of who we are as a population in order to allow people to function at their best. That's my take on it.
Good take. Thanks.
Michelle, this is Jill, Michelle.
Hi,
I'm
Jill.
listening, going off the screen. I have a question for you, Michelle. I'm seeing more and more and more health coaches pop up on, you know, sometimes just on your main street, you go down and there's a health coach. My concern, and I'm wondering how you feel about this as a registered nurse and someone who's been in healthcare for a very long time. I have a daughter who's a dietitian, who's well trained. My concern is the level of expertise and training of someone who calls himself a health coach. How do you feel about that?
I agree. It takes nothing to call yourself a health coach now. So kind of like we talked about interviewing naturopaths, I would interview health coaches and see if they have any health background. You know, as licensed and board certified, I can certainly lead in a different way than somebody who's recently received a certificate of some sort.
Okay, thanks, Michelle.
Mhm.
We do have a typed in question. And the question is, what do you think of the efficacy of various rubs and patches?
Depends on what it is. And so there are some that are incredibly effective, like fentanyl for people with terrible long-term chronic pain. Very dangerous, but very effective. The diclofenac gel, the a couple of years ago, you can use for arthritis and rub it in. It's like a non-steroidal, kind of like ibuprofen, but you can rub it in so you don't have the effects on your blood pressure and your kidneys and your stomach. Very effective for a lot of people. So, and then part of it, just like we massaged our hands, sometimes the effective of creams and rubs is just that touch factor, maybe even more than whatever the substance is.
Okay, thank you.
I have a question.
Yeah, go ahead. Yes, please.
I've been reading this book called Breathe or Breath by James Nestor. Have you seen that book or read it?
I can't quite hear you.
Could you repeat the title, please?
Yeah, I think it's called Breath or Breathe.
Yeah, man.
And it's James Nestor is the author.
Science of the lost art.
And it's about breathing, how it helps with many aspects. And I noticed in your talk today, you emphasize breathing.
Could you come closer to the microphone, maybe? I'm not quite hearing.
Okay. So the title of the book is called Breath, and it's by James Nestor, and it's called The New Science of Lost Art. And I wondered if you had seen it. It was a New York Times bestseller.
I think you were asking about a book called Breath. Is that correct?
Yes.
I'm not familiar with that, but it's probably this sort of thing of just kind of how to use your breathing to calm your mind. Is that what it is?
Well, the author provides evidence of a lot of medical results that come from using breathing techniques.
I think you said that the author says that there are a lot of medical or health results from using your breathing.
Yes.
Yeah, I would agree with that. I've not seen that book, but I agree with that principle.
Thank you.
I thank you. I thank you all for the opportunity to be here.
Yes, thank you so much, Michelle. Give you a clap here. I think we'll give you a virtual clap, and hopefully at some point we'll see you in person as we move forward here. And it's been a pleasure having you in our office today as you make your travels through Maryland. So thank you so much.
Welcome.
Also to our client care members, thank you for participating and for your great questions. Really do appreciate it. It adds a lot of value to the presentation and helps others learn, as I always say. So it is 11:54. Interest in the presentation has taken up a lot of time, which is wonderful to see. So we were going to leave a little bit of time for, should time allow, to ask some questions of Gary and Steve. We do have a few minutes here at the end. Did anyone want to pose any questions to Gary and Steve here at the end?
Sounds like a no.
So if there aren't, or if you have something and you're thinking about it, I'm going to go ahead and mention regarding our upcoming events. We have our 2022 annual client event. I'm very happy to announce on Saturday, May 21st from 8:30 to noon to be held at the 10 Oaks Ballroom in Clarksville. After the challenges of the past 2 years, we are thrilled to be back in person for the event, and we are working to make this our best event ever. With presentations from economist Dr. Anirban Basu, one of the most sought after speakers in the Mid-Atlantic, along with presentations from Gross Mendelssohn's Technology Group and Baltimore, Washington financial advisors, as well as Steve Elville and Gary Greenwald. We have a powerhouse lineup and cannot wait to host you. To go along with our educational presentations, we have delicious breakfast, music, and more door prizes than ever. And we have some new surprises as well. So I am personally so excited. I wish it were tomorrow, but first I have to pull it all together. So we are looking forward to hosting you in about 9 weeks, I guess, and just can't wait to see you there. So there will be a live stream option that for those that wish to attend virtually, and invitations will be coming out more than likely at the end of this week. So Gary and Steve, would you like to comment at all?
First, I was very impressed with the speakers this morning. I learned a lot, and I think we're very fortunate to have them. And I'm also looking forward to May 21 when I can see Steve's clients and my clients in person after all these years. And I will not be the musical, I will not be the musical presenter. Somebody else will do that one day.
Yes.
And Jeff, I would echo what Gary is saying, and I'm glad we're going to be back together. And I just want to thank you, Jeff, for organizing this today and being our moderator. And all I can say is wow to Dr. Fritsch and her incredible information and her continuing information that she's so willing to provide. And also I want to thank Jill Rosner, Aging LifeCare Manager Extraordinaire. And I also just want to say I do have this huge list, which is updated from the Maryland Estates and Trust section of the Bar Council of the Bar. And so if anyone is interested in getting the latest and greatest status of bills that are before the General Assembly that have to do with estates and trust, please let Jeff know and let us know, and we'll get you this list. So I'm very happy to say we have this list. And in the interest of time, I won't go over the individual bills, but just know there's some interesting things there. So power-packed morning. The only thing that concerned me was when Gary asked those questions about marijuana, I think Jeff and I are going to have to do a search of his office, but no, I'm just teasing. Anyway, we've had a great morning, and Jeff, I'll turn it back to you.
Well, thanks. So I will be sending out the video and some follow-up from today's presentations, and we'll get that out within the next day or two, Monday or Tuesday, also to Gary's clients as well. And just want to thank you for a great morning. Thank you to Jill and Michelle, and thank you to everybody for being here today. And look forward to sending out some more information about our 2022 annual events here very soon. Hope you have a safe day. Haven't looked outside recently, but I'm sure it's still snowing, and it's winter's last gasp before we have spring coming on board here. So everybody have a great rest of the day, and thank you for your relationships with our firm. We appreciate it, and we'll talk to you all soon. Take care. Thank you so much.
Thank you.
Bye, everybody.